If, by late afternoon, you feel like your lower legs have gained an inexplicable amount of weight, as if you were walking through quicksand, or if you notice your ankles looking different and feeling tight after a normal day, you have likely heard that this is simply the price of accumulating decades of experience. Many people in their 60s or 70s accept poor circulation as an unbreakable rule of biology, something as inevitable as your hair changing color or needing to take your mornings a bit slower. However, what usually leaves my patients speechless when I explain it to them in everyday terms is that the root of the problem does not always lie exclusively in the body's central engine, which is the heart, nor in the main pipes, which are the arteries. In a surprising number of cases, the real culprit is a set of auxiliary engines located in your lower legs that have silently gone into hibernation. I am Dr. Elena Ross, and today I want to share a fundamental principle with you that we have studied for years in vascular and orthopedic medicine, but which rarely reaches the general public with the necessary clarity. Imagine that your legs have their own hydraulic return pistons. These muscles in the back of your leg work as a secondary pumping station that assists the heart in the difficult task of fighting gravity. Every time these pistons are activated, they generate the pressure needed so that fluids do not get stuck in the basement of your body, but instead travel back up toward your torso to be oxygenated. When these engines lose power, the fluid tends to pool in your lower extremities, which explains why the heaviness, discomfort, and swelling almost always show up at the same time, like inseparable companions. To back this up with rigorous science, we can look at an in-depth analysis published in a Journal of Applied Physiology in the year 2021. In this research, a group of scientists observed older adults who had mild difficulties with venous return blood flow. The results were fascinating because they proved that a conscious, targeted activation of these muscle engines achieved a substantial improvement in fluid movement in a matter of weeks. The most interesting part of this finding is that the volunteers were not running marathons or lifting heavy weights. In reality, they were performing an extremely subtle movement pattern, one that most people completely ignore because it seems too simple to have a real impact. It is important to clarify that going for a walk is still a wonderful activity for your overall health, but walking alone, especially after crossing the threshold of your 60s, does not always send a clear enough signal to these muscular pistons. For this reason, in clinical practice, we usually suggest incorporating a specific technique to revitalize leg blood flow and alleviate those aches that can ruin your afternoon. In this video, I will walk you step by step through a progression of movements designed to be done safely, respecting your body's wisdom, and starting from the ground up, exactly as we teach it in specialist consultations. If you stick with me until the end, you will understand why this method can bring that feeling of lightness and agility back to your steps without needing external tools and without exhausting yourself. Exercise number 5, the seated pump ignition. This is the first step on our staircase to wellness, and it is the technique we usually use to wake up the system when a patient, like James, a 72-year-old man who used to enjoy reading but suffered from tired ankles by the end of the day, asks us where to begin. Many people dismiss this movement immediately because it looks insignificant, but this is exactly where the power of deep muscle reactivation lies. This exercise targets the system that manages the upward pressure of fluids in your limbs. By doing it, we are sending a direct electrical signal to the muscles so they can act as active valves once again. To begin, find a sturdy chair where you can sit with your back straight but relaxed, making sure your feet have firm contact with the floor. There is no need to stand up, which eliminates any concerns about balance or strain on upper joints like your hips. The core of this movement involves slowly raising your heels while keeping the front part of your feet, the toe area, firmly anchored to the ground. As you execute this action, you will feel the calf muscle contract and then stretch rhythmically. Think of it as if you were operating a manual air pump to inflate a tire. Every repetition is a stroke of pressure that helps fluids overcome the resistance of gravity. In our daily lives, the importance of this mechanism is greater than we usually realize. When these engines stay still for too long, the fluid pools, creating that feeling of internal pressure and a dull ache. By strengthening this pumping station, we are providing vital support to our vascular health even when we are watching TV or taking a long trip. The study I mentioned earlier emphasized that it was not the intensity that made the difference, but the precision of the movement. The participants who showed the most progress were those who performed these controlled contractions, sending clear commands to the tissues responsible for fluid transport. To practice this safely, keep your posture aligned and place your feet about shoulder width apart. Raise your heels as high as you can without feeling pain. Hold that contraction for 1 second at the very top, and then lower them smoothly, preventing your heel from hitting the floor hard. Slowness is your best friend here. A very common mistake people make when trying this on their own is rushing. They believe that by doing it fast, they will get better results. But the reality is that speed cancels out the hydraulic benefit. Another crucial aspect is breathing. Avoid holding your breath, as this can alter your internal pressure and cause you to feel dizzy. For you, this exercise represents the beginning of regaining your autonomy and comfort. It is something you can integrate into your daily routine without getting fatigued, and it is the perfect foundation for what we will do next, where we will start to involve more joints in the process. Exercise number 4, the fluid lower hinge glide. Once we have woken up the main engines in the lower legs, our next goal is to ensure that the pathways passing through the upper joints are clear. In this step, we focus on getting the ankles and knees to operate in a coordinated dance, which is vital for keeping a steady flow as the years go by. Just like the previous exercise, we will maintain the safety of the seated position so you can fully concentrate on the feeling of the movement without distractions. Imagine your knee is like a wooden drawer that has been stuck closed for a long time, and now we want to open and close it smoothly after applying a layer of wax. Sitting in your chair, with your back well supported, you are going to slide 1 foot backward, bringing it closer to the base of the seat so that the knee bends naturally. Then you will slide that same foot forward, extending the leg until it is almost straight. We are not looking for an extreme stretch or a display of muscle strength, but a back and forth motion that guides the joint through its natural range. This gesture is fundamental because many older adults spend hours with their joints in a static position. When the knee stays bent at the same angle for a long time, it acts like a kink in a garden hose, making it harder for the flow to continue its way up. By restoring this pattern of flexion and extension, we are unkinking the hose and allowing the body to better manage liquids in the lower body. Data collected by top-tier health centers suggests that this type of repetitive joint movement drastically reduces stiffness and improves tissue health in seniors, especially when performed right after activating the calves. To put this into practice, place your hands on the sides of the seat to feel more secure. Slide one foot backward in a controlled manner and then forward, feeling how the fluid seems to follow the rhythm of the movement. Repeat the process with the other leg. If you notice any discomfort in the knee area, simply reduce the sliding distance. The important thing is the consistency of the movement, not the range. One mistake we must avoid is trying to force the knee or doing the movement abruptly. Think of this as if you were polishing a delicate surface. It is all about smoothness and rhythm. This exercise not only improves your internal flow, but also gives you the confidence needed for the next level, where we will prepare to support our own weight actively. Exercise number 3, the assisted weight shift. After setting the stage with the seated exercises, the time has come to invite our body to rediscover how to handle its own structure while standing. In this stage, we introduce a controlled load that is essential for re-educating the nervous and vascular systems. For this movement, it is absolutely necessary that you stand behind a heavy piece of furniture, a kitchen counter, or a chair that will not move, using your hands as a light but constant point of support. Your feet should be parallel and firmly planted. The technique consists of shifting your center of gravity very subtly. You are going to lean your weight slightly onto your right leg, feeling how the sole of your foot presses into the floor, and then you will return to the center to shift over to the left. It is such a small movement that someone watching from a distance would barely notice the change. This is not about lifting your feet or balancing on one leg. It is about teaching your hips and limbs to share the responsibility of holding you up. In daily life, this weight management ability is what allows us to take every step safely. Every time you turn to reach for something in the pantry or adjust your position to speak to someone, your body performs this weight shift. If this process becomes stiff or hesitant, circulation suffers and the risk of instability increases. Mobility experts for seniors emphasize that these assisted shifts are one of the best tools for improving communication between nerves and muscles, promoting a rhythmic blood flow without the stress of an exhausting workout routine. As you practice, keep your gaze forward and your shoulders relaxed. Feel the weight move from side to side as if it were the arm of an old metronome, keeping a steady, safe beat. If at any point you feel unsteady, simply apply more pressure with your hands on your support. A common mistake is locking your knees completely, which stops the muscles from working. Try to keep a tiny bit of bend in them, as if they were shock absorbers. This exercise is a bridge to independence, preparing you for more functional movements in the next step. Before we continue with the remaining exercises, I would love for you to drop the word health in the comment section and share your experience so we can stay connected. Also, do not forget to hit the like button and share this content, as this helps other older adults find this path to wellness. Exercise number 2, the seated power transition. As we gain confidence, we must focus on a movement we do dozens of times a day, which is one of the greatest sources of health for our legs, the act of going from sitting to standing. This exercise is an absolute gem for vitality in your 60s and beyond, as it engages the largest muscle groups in the body, which are the true engines of our circulation and independence. Take the example of Robert, a 75-year-old gentleman who felt he increasingly needed his arms to help him stand up. By practicing this movement in a controlled way, not only did his strength improve, but his legs stopped feeling like concrete blocks. To execute it, sit on the edge of a sturdy chair. Your feet should be firmly planted on the floor, pulled back slightly so your heels are just behind the line of your knees. The movement starts by gently leaning your torso forward, shifting your weight onto your feet, and then using the strength of your thighs to rise until you are completely standing. Once up, take a deep breath, pause, and return to the starting position by lowering yourself with the exact same slowness and control you used to stand up. You can use your hands on the armrests if you need to, but the goal is for your legs to do the majority of the work. Every time you stand up this way, you are triggering a massive, coordinated contraction of your thigh, glute, and calf muscles. This joint action works like a giant hydraulic press that pushes fluids back toward the heart with astonishing efficiency. Avoiding this movement out of fear or weakness is what often worsens pooling problems. Several longevity studies indicate that the ability to stand up from a chair with control is one of the best indicators of vascular and muscular health in older adults. When practicing, make sure to take at least 3 seconds on the way up and another 3 seconds on the way down. The slowness guarantees that the muscle spends more time under productive tension, which is infinitely better for venous return than a fast and explosive movement. Do not just drop into the chair on the way down. Control the descent as if you were landing softly on a fragile surface. This exercise gives you a sense of power over your own body and leaves you ready for the final movement, where we will combine everything we have learned into one total flow sequence. Exercise number 1, the complete flow cycle. We have arrived at the movement that many of us specialists consider the gold standard for leg health in your golden years. This is not the most valuable because it is difficult, but because it is a perfect synthesis of everything your legs need to function well: engine activation, weight management, and coordination. It is an exercise that connects the dots and teaches the body to work as a harmonious unit. For this final exercise, stand up with your sturdy support in front of you. Start with a gentle heel raise, feeling your calf engines turn on for a brief moment. After lowering your heels, do a very slight knee bend, just a few inches, as if you were about to sit down but decided to stay standing, and return to the starting position. It is a flowing cycle. Raise the heels, lower them, bend slightly, and straighten up. It is a continuous, elegant movement that mimics the dynamics of daily life. Why is it so effective? Because in reality, our muscles do not work alone. When you walk or climb a step, your calves and thighs have to communicate in milliseconds. By practicing this coordinated cycle, you are reinforcing that communication and ensuring that the fluid pump works at peak capacity all day long. It is the biological equivalent of syncing all the traffic lights on a main avenue so that traffic flows without interruption. Public health guidelines for seniors highlight that these types of combined exercises are far more powerful for preserving mobility and venous return than any isolated exercise. As you do this, try to keep your breathing natural and deep. If you feel tired, stop and rest. This is not an endurance competition. A common mistake is turning this gesture into a deep squat or a gymnastics routine. Keep it small, safe, and consistent. Think about the flow in your legs as you do it, visualizing how every repetition lightens the pressure in your ankles. If I had to choose just one activity to do every morning when getting out of bed, this integrated sequence would be my professional recommendation to keep your legs young and strong. Throughout this session, we have discovered that the health of our limbs is not a losing battle against time. It all starts with that conscious awakening of the engines that assist the heart. We have gone from subtle seated activation to joint mobility, then learned to balance our structure, and finally integrated that strength into movements we use in our daily lives. Every step on this staircase has been designed so that your body feels respected and stimulated at the same time. When these techniques become a regular part of your days, changes begin to manifest in wonderful ways. That feeling of having your legs in chains at the end of the day starts to fade away. The act of getting up from your favorite armchair stops being a challenge and becomes a fluid motion. You walk with renewed confidence, not because you made a heroic effort, but because you reminded your body how to work. Together, the key to success here is not brute intensity, but intention and the constant repetition of clear commands to your muscles. Remember that this video is an educational tool, not a medical prescription. Do not make changes to your health plan without consulting your doctor first. Use this knowledge to enrich your next professional visit. True wellness is born from the joint effort between you and your healthcare team. Protect your independence with safe decisions, always guided by experts. You have built a valuable life and deserve to live it to the fullest. Do not let silent problems steal your mobility. If this video helped you, subscribe and share it. But listen closely. Taking care of your legs is just the beginning. Your feet could be sending urgent messages that you ignore, thinking they are normal, but which could actually be warning signs pointing to diabetes. I invite you to watch the video on your screen right now. What you discover today could save your wellness tomorrow. Do not ignore it.